Good afternoon, and I'm very pleased to chair this last session of today. So my name is Matthiessen, and I work for the European Commission, and he's currently heading the unit responsible for infectious diseases and public health. So in the morning and this afternoon, we have heard the perspectives from the different African countries, and indeed had, I think, a very good discussion and input from the individual countries. And now we are going to hear from some of the different sub-regions programs, as well as at continental level. So I will immediately give the floor to the first speaker, Professor Ambali, from who is the Director for Policy Alignment and Program Development at NEPAD. Please.
As indicated by my new chair, my name is Aggrey Ambali. I'm from the NEPAD agency. I head what is called NEPAD Science, Technology and Innovation Hub. This evolved out of a directive by the Minister of Science and Technology that actually NEPAD established this particular hub. So basically, in our structure within NEPAD, science and technology actually in one department, which is the hub, which I head. Now, I think I was requested to speak on two areas. One, the involvement of NEPAD in supporting and sustaining health research and such capacity. The second one was basically how NEPAD is involved in improving partnership with the EDCTP to reduce the burden of poverty-related diseases and neglected infections in Africa. Within the NEPAD outfit, NEPAD is quite involved in supporting and sustaining research in health as well as research capacity. As the minister from Congo, who is the chairperson of AMCOST, indicated this morning, the African Union, that is through the African Commission and its technical arm, NEPAD agency, have actually been working on an AU Science, Technology and Innovation Strategy 2024, which is a 10-year strategy. Now, within that strategy, I think what is quite important is that the ministers 2 weeks ago located science and technology as a central driver of all these other impact sectors of the African Union. So basically, being the driver of agriculture, health, environment, and other sectors. So I think it speaks to what the minister was saying earlier on, that this is a forum where you need to bring along the department responsible for science and technology of the African Union, and that's the social science and technology, because that's basically the way the union is organizing itself in terms of how to look at the whole issue of STI. So NEPAD basically has been in the forefront of that, even in the so-called CPA, which was approved in this very same hotel where we are in 2005, was actually driven by NEPAD within the AU system. So at least we are involved in actually defining a strategy for the science, technology, and innovation. The other area is that NEPAD has been involved in is the area of impact assessments in health research programs. This is there to look at what sort of impacts are coming out of the research programs that are going on. This is really an attempt to build a strong monitoring and evaluation system within the health research programs. Several case studies have been carried out in Tanzania, in South Africa, and I think there's one in West Africa where NEPAD has been trying to look at what is coming out of this, and basically how do we really build a robust M1E system. Now, this is important because if you remember, out of the Abuja core, I mean, there was a very, robust set of indicators that should be used to monitor, the Abuja provisions, and that's where now NEPAD say, how do we actually work with our, our colleague, the African Union Commission, in trying to really build that M1E system to address such type of, instruments or provisions that the heads of state or ministers have come up with. The other involvement, and this is really a program which was started by the Minister of Science and Technology, and indeed it fits quite well in health. This is the African Union Pharmaceutical Manufacturing Plan for Africa, PMPH, and I'm sure that PMPH, I think it will be mentioned later on. Now, within there is the whole issue of regulating medicines registration, regulating, the whole issue of access. Now, NEPAD, through what is called the African Medicines Security Harmonization Program, has actually been working with regional economic communities in trying to actually build medicines regulatory systems at regional level. The first program was launched in the East African community last year, and now the process is underway within the ECOWAS region, working jointly with the WAHO and the UMWA. And the same or similar kind of processes are also ongoing in ECAS and in the SADC region. So now here you see that if you talk of clinical trials, yes, quite a good process pushing technology through, but we also need to build robust regulatory systems that actually can enable to actually do a good job in as we do some of these things. So really, NEPAD is working on that, and that work is now extending to vaccines, and indeed discussions are quite mature with EDCTP along some of those lines. The other area is, I think a representative from Kenya did mention the fact that probably one of the things that there's need to align with national priorities. I think NEPAD has been involved in what is called research for health in Africa, where it is working with member states to really set up priorities for research and even policies. Because sometimes we're talking of some of these countries, our countries have been probably have been good at delivering health systems, but not necessarily looking at the R&D in as far as health is concerned. So if you look at some of our instruments that we have at national level, you find that maybe there's an overall public health delivery policy, but not necessarily a health research or research for health policy. Now you need a good policy for you to really anchor some of these initiatives, that speaks as to what are the priorities of a given country and what have you. The other area where NEPAD has been involved in the area of health is this whole issue of centers of excellence. Through what is called the African Biosciences Network, African Biosciences Initiative, we've set up several regional networks. For instance, the network in Southern Africa, one of its key areas is health. And indeed, it is through that network, that's what is called Southern African Network for Biosciences, where a robust validation system for herbal remedies has actually been developed. And what did we do? We actually had to go for a remedy in Zambia, what is called Sondashi 2000, that actually we brought it on the regional table or regional platform, and this is where scientists in that region were able to actually, because of testing this herbal remedy. Right now, the government of Zambia has put money into that herbal remedy, actually taking it through the various, protocols of, looking at the, safety and efficacy of that remedy. So basically, that's also work that we've been championing. Now, the other area, I think the minister from Zambia indicated here that probably one of the issues that also we should be looking into is that the investments or contributions from member states are not adequately quantified. Now, NEPAD basically has a program on the actually indicators, which is capturing investments that member states are making in research and development. So sometimes we can say, yes, there's 2%, there was 1%, but nothing has been done. Probably that is a sweeping statement. It's high time we really looked into what countries are doing. Actually, the story is saying something to the contrary. Quite a few countries have actually met that 1% target. You know, but we need to be having data that can support some of the allegations that we do make. So NEPAD again is involved in this whole process of tracking the investments that member states are making into R&D. And actually, if you look at that process, health again is quite well financed. Actually, the challenge that we have there is moving technologies to market. Actually, that's where we see to be a big challenge in as far as Africa is concerned. Africa, from what is coming out, is not quite limited of input investment that is into R&D, but I think it's basically going beyond, you know, the research findings to process that thing now into the market. This is where actually we have a problem. In which case, actually, we are now looking at how do we, as NEPAD, really establish what we call innovation platforms, where we should be looking at policy makers, business, and research. You know, having a platform where they can be engaging and look at how they can actually pull out this valley of death in as far as technologies are concerned. So really, that information is available, and NEPAD, working with the partners, is actually producing some of that information. I may also indicate here that working with the AUC, UNAIDS, we've also been involved in the assessment of Africa and G8 commitments in as far as malaria, tuberculosis, and HIV are concerned. And last year, we did produce an assessment report that this is what I'm saying here. I'm talking of NEPAD, AUC, and its technical arm, the NEPAD agency. We did produce a report, and UNAIDS a report on how basically we are faring on the various commitments that have been made. Let me also indicate that WHO was also part of that particular process. Now, looking at the partnership with the EDCTP to reduce the burden of poverty, related diseases, and infections in Africa, I would say that we have had quite an active engagement with EDCTP. We are talking to EDCTP. Actually, one of the areas, as I said, this whole issue of building strong regulatory systems in our member states. EDCTP has interest in this because clinical trials, you need a good regulatory system at national level, at regional level. Issues of pharmacovigilance, we are discussing with EDCTP in those areas. So basically, I would say that it's an ongoing discussion, and we see ourselves as co-investors into this partnership. The other is the issue of centers of excellence. As I wind up, which I mean, we've been talking about here, you know, these centers of excellence, one day you shall want to look at them to the same government and other systems. We are building that platform. We've learned so much. I mean, we've got so many networks within the AU process. The networks in water, in energy, in bioscience, as I said, and we see that actually even biosafety for that matter. So we see that you know, as we really build up the health research platform, these centers of excellence actually they will be really springboard upon which basically we will be building the African R&D capacity that has to push some of these things. So these are some of the discussions that we're having with the EDCTP. Thank you, Madam Chair.
Thank you very much. And I will give the floor to the second speaker this afternoon, so Dr. Moeti, who is Deputy Regional Director at WHO Regional Office for Africa. Please.
Thank you very much. So WHO believes that high quality research is an essential pillar of helping countries to attain for their citizens the highest standard of health. And we know, of course, that it also has a great potential to generate income through innovation and contribute towards economic development. And one of the core functions of WHO, expressed in our constitution, is to promote and conduct research in the field of health, and it's been recently updated to shaping the research agenda and stimulating the generation, translation, and dissemination of valuable knowledge. WHO's strategy on research for health, adopted by ministers of health in 2010 at the World Health Assembly, is based also on the premise that policies and practice in support of health worldwide should be grounded in the best scientific knowledge. As you probably know, WHO's role in global health is very much that of supporting the setting of policy, especially at country level, but also at regional level, helping to develop evidence-based strategies, building capacity, providing technical support, and also monitoring and evaluating both disease trends and also outcomes and impacts in terms of health. So our involvement in research is very much along these core functions, and I'll just give a few examples of what. First of all, it's already been said in the meeting that in advocating for and supporting the appropriate prioritization and development of regional policy on research and health, WHO convened a conference of health ministers and ministers of science and technology in Algiers, Algeria in June 2008. And in the declaration that came out of that meeting, the ministers committed to various actions aimed at strengthening research for health, including increasing the allocation from the national budget to research for health, targeted at 2%, that's already been mentioned, and accelerating the translation of research products into national policy, action, and services. So WHO is supporting the implementation of this declaration, including through providing technical advice to countries to develop national health research policies and strategic plans, and also helping them set their research priorities. In order to strengthen countries' regulatory capacity, and this has already been alluded to as well, and therefore speed up the application of existing and new research products, WHO in 2005, in the area of vaccine development, established the African Vaccine Regulatory Forum, also called AVRF. And this forum provides a platform for networking, harmonization of approaches, capacity building, and sharing of expertise for review of dossiers among national regulatory authorities from African countries. And we now have 23 countries involved in this, and it has started to show concrete results in accelerating the registration and introduction of new vaccines. This experience can be extended to other medical products, and we also do work with national regulatory authorities in terms of medicines regulation. And as also already been referred to, we also are a partner in this medicine plan. We recognize that there is a paucity of medicine and biological devices, and this led WHO to establish the African Network for Drugs and Diagnostics Innovation, also called ANDI, which is an initiative for stimulating R&D for priority health problems in the African region, run with African capacity in partnership, of course, with the international community. And this ANDI seeks to discover, develop, and deliver new drugs, diagnostics, and vaccines that address the region's priority problems. WHO has also, in a few cases, worked with partners directly towards product development, and we were very happy with the results of our work on developing a vaccine for meningitis, for the Neisseria meningitidis serogroup A, which was developed and introduced, it's called the meningococcal A conjugate vaccine, in most of the meningitis belt countries, and we've already seen the results in terms of quite a dramatic reduction in meningitis A cases in those countries. In order for research to contribute optimally to improving health, it's already been said, its outputs and products have got to be translated into policies and strategies and services that actually reach people in the countries. So we try and work on this in a number of ways. WHO improves the process of dissemination of public health and research literature through the Health Internet Network's Access to Research Initiative, also called HINARI. So it's a way of disseminating information about what's coming out in research so that program managers and decision makers and other technical experts in countries are aware and work on adapting those for incorporation into their own national programs and strategies. We've also established a knowledge translation platform called the Evidence Informed Policy Network, or EVIPNet, which is now functioning in about 7 countries in the region. And this is, again, a group that looks at how to translate what's coming out of research into policies in countries, into programs, and into service delivery. And one example of some of the work done by the EVIPNet teams in CAR, Central African Republic, Cameroon, and Burkina Faso was a contribution that they made to the use of artemether in the treatment of malaria. We share very much EDCTP's vision and objectives of focusing on diseases of poverty and the emphasis on building capacity to conduct research through training and funding for research and establishment of centers of excellence, thus simultaneously innovating and delivering products with great potential for use by countries. And this, we've already had examples given of how the EDCTP work has concretely contributed to interventions in countries. So we really commend the considerable investment by EDCTP in clinical trials, and particularly in the training of African professionals and young researchers. We strongly agree with the proposed EDCTP2 agenda, particularly of neglected tropical diseases and operations research. We also endorse the principle and intention to strengthen African engagement and involvement in EDCTP dialogue, decision-making, investment, and action. We did facilitate through our regional governing body called the Regional Committee, which is the annual forum of ministers of health in 2010, the identification of representatives of health ministers at the EDCTP General Assembly. We recognize that there is need to strengthen this mechanism and render it more effective for consulting health ministers and bringing their views and suggestions to the EDCTP General Assembly. I think one of the gaps that occurred was the failure to concretely establish such a mechanism of consultation in which WHO could have provided additional assistance to the focal points that attend that assembly on behalf of ministers of health. Taking into account the discussions that have occurred today, I think we are understanding that we are emerging with the suggestion that some countries will be represented directly, either through the health or science and technology ministries. And there will be also an attempt to sub-regional and even regional representation. We would like to say that we are still available. WHO still offers and is available to provide support in this context. And we could, through joint efforts of the WHO Secretariat at our regional office and also WHO country offices. I think one of the advantages that we have is that WHO has a country office in virtually every country in the region. So the process of information exchange, consultation, and obtaining the views of members to go forward through their representatives to the General Assembly could be facilitated by WHO country offices. And working together with our regional office, this is something that we could offer to do. We also, as I said, have this forum, WHO Regional Committee, where all the ministers of health virtually every year at a possible forum for discussion, for direct discussion between the representatives in the EDCTP General Assembly and the Ministers of Health. We doubt, of course, that we could put this as a formal agenda item, but there are lots of opportunities for organizing side events where we could have briefing sessions for the ministers and dialogue and information exchange to enable the representatives at the General Assembly to truly represent the views of the ministers as they have had them. And we have a way of organizing these meetings where we can disseminate documents ahead of time so that the ministers can read them and understand what is happening, and they can be assisted in these processes by our colleagues who are based at country level. We already work extensively with ministries of health in adapting and using norms to shape national health policies and guide service delivery. So again, WHO could assist in terms of the outputs of research, which is supported by EDCTP programs to enable the ministers and countries to be aware of what is going on in terms of research, to be aware of what is coming out in terms of research, and also to incorporate these research products into their national strategies, technical guidelines, and so on. We could also provide information that would help the ministers really get well informed and the value added of the EDCTP program, and this would be part of the advocacy in terms of their efforts to secure funding for research, specifically research related to this EDCTP program. Finally, we recognize that the sustainability of research in the region will be assured if the member states are able to rise to the challenge, also to rise to some of the commitments that they've already made, for example, at the Algiers and Bamako conferences, and give priority to the development of policies for research and innovation for health, adopting a multi-sectoral approach, as has already very clearly emerged from this meeting. Not only will this impact positively on the health of populations, but it also has great potential to generate income and to contribute to economic development in the countries and in the region. So WHO is ready to work with the EDCTP Secretariat, with the member states, and with researchers to help achieve these objectives using the various options and opportunities that have been put forward today. And I'd like to thank you very much.
Thank you very much. And now the last speaker of this session, I'm pleased to hand over to Kaloko from the Social Affairs Department of the African Union Commission. Please.
Honorable ministers, distinguished participants, I felt quite comfortable after listening to my counterpart from NEPAD, because a few minutes I was sitting here listening to you, I thought I was a little bit out of queue. One of the reasons I made sure that I attended this conference or meeting is the fact that we are at a point where we really want to change a few things at the African Union. We've been having a lot of problems with implementation. We have a lot of decisions, a lot of declarations. Implementation has been very, very difficult for us. So we decided to take a look back and what we discovered, or what we're thinking that could probably be wrong, is maybe our narratives, you know, what we start off with before we put up the programs. Do we have the right narratives? Have they been influencing the indicators? Is that why we're having difficulties actually getting down to implementation? Then we looked at it again and thought, well, probably we didn't have the right data, you know, to even set up the narrative in the first place. So there is a paradigm shift. If you go to the United Nations Economic Commission for Africa, you know, in Addis Ababa, you'll find out that they've decided to build up their statistics departments to make sure that we have the right data that we should be leading with, and hopefully improve our implementation. Now, to this end, I would like to express my gratitude and appreciation to EDCTP for such an honor and for collaborating with the host country, Senegal, to produce the excellent arrangements which brought us here and have kept us in this comfortable environment to discuss the important question of scaling up Africa's role and involvement in the partnership. As a representative from the African Union, an institution charged with the responsibility to direct and interests of the continent, an opportunity that much ground has been covered in our struggle against the 3 killer diseases, that's HIV/AIDS, TB, and malaria. A struggle to which the efforts of this partnership is devoted, and the raison d'etre of its existence. However, more needs to be done to ensure that these 3 killer and poverty-related diseases are neutralized and cease to pose threats to the well-being of Africans. With this in mind, and considering the fact that the new strains of drug resistance in TB and malaria are inhibiting our efforts and tending to reverse the gains made so far, we have moved forward, forging partnerships, calling for increased resource mobilization, and scaling up interventions to eradicate. The extraordinary summit in Abuja was hosted to evaluate our gains, as well as to adequately confront the challenges posed by the 3 diseases. In the well-articulated declaration that emerged from that summit, the heads of state agreed to intensify research aimed at strengthening preventive measures to curb the spread of the 3 diseases. They also recognized the need for an African Center of Disease Control, a kind of a CDC, to conduct life-saving research on priority health problems and to serve as a platform to share knowledge and build capacity in responding to public health emergencies and threats. The heads of state further tasked the Commission to work out the modalities for its establishment and called on partners, including private sector, to support the already established pharmaceutical industries on the continent and the implementation of the pharmaceutical manufacturing plan for Africa and its business plan, which was mentioned by my colleague from NEPAD. And this aims at producing affordable, quality-assured, safe, efficacious, and essential medicine for the pandemics and other communicable and non-communicable diseases. These efforts reinforce earlier commitments and interventions in HIV/AIDS, TB, and malaria, as witnessed by the route taken since Abuja 2001. Much as these efforts have evoked and contributed to ambitious programs and projects on the continent, they have also revealed gaps in research and clinical trials, a serious gap that prevents us from reacting promptly and adequately to emergencies and other complexities in public health. Funding is one major obstacle for the establishment of effective research institutions that would respond to threats posed by HIV/AIDS, TB, malaria, and other infectious diseases. Another serious setback is the availability of qualified manpower to run such institutions, especially as those already trained prefer to migrate to destinations that ably remunerate them for skills, knowledge, and expertise. But our complacency and reliance on outside help, even infectious diseases, and thereby reducing mortality and morbidity, arising from such disease. I have come with a cost, heavy debt tolls, and huge socio-economic consequences for the continent. For example, HIV/AIDS in its devastating heydays wreaked untold havoc on this continent. The response to tackle its bold, death-threatening rage did not come as rapidly and coordinated as it is today. One would imagine or love to ask, what would have been the result if the continent 20 years had its own research, 20 years ago had its own research centers capable of developing new or improved clinical interventions to combat HIV/AIDS? What would be the impact on public health, socio-economic indicators, peace and security, returns on African taxpayers' investment 20 years after, if we now concentrate our efforts in scaling up research and clinical trials initiated and driven by the continent in collaboration with our partners? The answers to the 2 questions, I'm sure, are obvious. This is why we have now called for a step up in research and establishment of a continental Center for Disease Control or centers for disease control, that is if we do it regionally, so have regional communities and our partners such as UNIDO to ensure the implementation of business plan, the pharmaceutical manufacturing for Africa, commonly known as the PMPA. And we are now enlivened by recent developments and the flourishing momentum that some member states have accorded to implementation of competence in research and solid experience could these efforts. We could jointly collaborate on the modalities and the establishment of continental state. We empower, while the EDCTP, of which we are also partners, research and the capacity to mobilize resources. Pooling our resources together and bringing on board our comparative advantage could enhance our collaboration and produce a combined effect with positive and far-reaching impact. Excellencies, ladies and gentlemen, for such collaboration to happen and to be sustained, African involvement, concern, commitment, and contribution towards the decisions, policies, and activities must be clearly demonstrated and felt in all the decision-making processes of the EDCTP. The selection process and criteria must be reviewed to take into consideration the gratifying effects of fairness and regional representation. We also need to tap into the expertise, innovations, and the resourcefulness of the African private sector and civil society organizations in order to give effect and visibility to the effects of EDCTP and ownership of its program by diverse actors and stakeholders on this continent. In conclusion, Your Excellencies, ladies and gentlemen, let me take this opportunity to once more thank the EDCTP for convening this high-level representatives meeting to discuss innovative ways of renewing financial participation in EDCTP and scaling up Africa's participation, representation, and engagement in the activities, policy initiation and implementation of EDCTP. I hope this meeting, no doubt, has achieved those ends. I thank you all and hope to meet at the same time, discuss with you individually or collectively here or in other fora and future EDCTP conferences on the discourse and outcome of this meeting, as well as the continent's health issues and programs that we all desire and working towards improving. I thank you.